This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved. Hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do. This is Yeah, We're Going There with Dr. Natalie, breaking the silence on pelvic health for women and men. Yeah, we're going there because knowledge drives better health. Welcome back to Yeah, We're Going There, the podcast where we talk about the health questions that you may be thinking about but aren't always comfortable asking. Last time, we talked about hysterectomy. What is it? Why someone might need one, the different types, and what happens to the uterus, cervix, fallopian tubes, and ovaries. Today, we're talking about what happens after the surgery. Because getting through the operation is one thing, figuring out what you're supposed to do once you get home, that's another story. So let's go there. How long does it take to recover? The honest answer is it depends. The type of surgery is one of the biggest factors affecting recovery. Many people recover in approximately 4 to 6 weeks, but recovery can be shorter after vaginal or laparoscopic surgery and longer after an abdominal hysterectomy. And those are general estimates, not deadlines. Your surgeon's instructions should always take priority because your recovery depends on exactly what was done and how your body is healing. So if your friend was back to normal in 2 weeks, that does not mean you're doing something wrong if you're still tired at week 4. 2 people can both have had a hysterectomy and have completely different recoveries. Immediately after surgery, it's common to feel tired or groggy, especially after anesthesia. You may also have abdominal or pelvic pain or soreness, bloating or gas, nausea, constipation, fatigue, and light vaginal bleeding or discharge. Depending on the procedure, you may temporarily have an IV, a urinary catheter, surgical dressing, or a drainage tube. And here's something that may surprise you. Your healthcare team will usually want you to start moving fairly soon after surgery, but once it's safe. Not running, not lifting weights, but walking. Gentle movements help improve circulation and reduces the risk of blood clots. Prolonged bed rest generally isn't the goal. Light vaginal bleeding or discharge can occur during recovery, and it may continue for several weeks. It should generally become lighter over time. The National Health Service notes that vaginal discharge can last for up to about 6 weeks following a hysterectomy. But there is a difference between expected light bleeding and heavy bleeding. Heavy bleeding, large blood clots, or foul-smelling discharge should be reported to your healthcare provider. Usually, gentle walking is encouraged as soon as your healthcare team says it's safe. Start small. Maybe it's just walking around the house. Then a little further. Then gradually increase your activity as your body allows. The goal isn't to prove how quickly you can recover. The goal is to recover safely. One of the most commonly asked questions is, when can I return to work? This depends on your surgery, how you're feeling, and what your job requires. Someone with a sedentary work-from-home job may return sooner than someone whose job requires heavy lifting, standing for long periods of time, driving, or physical labor. Cleveland Clinic reports that many people return to work within approximately 2 to 6 weeks, depending on the procedure and type of work they had done. So talk to your healthcare provider about your specific situation. Another common question has to do with driving. don't drive until you could safely control your vehicle, move comfortably, perform an emergency stop, and you're no longer taking medications that would impair your alertness or reaction time. There isn't one universal number of days that applies to everyone. Your surgeon's instructions should be your guide. How about exercise? Well, walking is generally encouraged early in recovery, once you've been cleared to do so, but more strenuous exercise should be resumed gradually. You may hear that 4 to 6 weeks is a common time frame for returning to more normal exercise, but again, that is not a universal rule. Your surgery and your recovery determine the timeline. Okay, let's talk about sex. Yeah, we're going there. When can you have sex? After hysterectomy. You should avoid vaginal intercourse and putting anything into the vagina until the surgical site has healed and your healthcare provider says it's safe. ACOG, the American College of Gynecology, commonly recommends avoiding vaginal intercourse, tampons, douching, another vaginal insertion for the first 6 weeks, although some patients may need longer restrictions depending on the surgery and healing. And here's something important. You may feel physically pretty good before the internal tissues have completely healed. Looking fine on the outside does not mean everything is healed on the inside. So don't use how you feel alone as your clearance. What happens to sexual function after hysterectomy? Again, there isn't one universal answer. Some women experience little or no long-term change. Some experience improvement because the condition that caused pain, heavy bleeding, or discomfort has been treated. Others may experience sexual symptoms, including vaginal dryness or changes in sexual function. If both ovaries were removed, the sudden decrease in ovarian hormones can contribute to vaginal dryness and other menopausal symptoms. So if sex is painful or different after you're medically cleared, don't simply assume, well, I had a hysterectomy, so this is just how it is now. Talk to your healthcare provider. There may be ways to address what's happening. Also, does a hysterectomy automatically cause menopause? This is one of the biggest myths. No, menopause is primarily about ovarian function. If both ovaries are removed before natural menopause, ovarian hormone production drops abruptly, and that is surgical menopause. But if your ovaries remain, they generally continue producing hormones. You won't have periods because you no longer have a uterus, but you could still have hormonal cycling. That means you could potentially experience symptoms related to ovarian activity, even though you no longer menstruate. If both ovaries are removed before natural menopause, the loss of ovarian hormones can happen suddenly, and possible symptoms can include hot flashes, night sweats, vaginal dryness, sleep problems, mood changes, anxiety, changes in sexual function. The loss of ovarian hormones can also increase the risk of bone loss. And this is one reason the decision to remove healthy ovaries isn't something to take lightly, particularly in someone who hasn't reached natural menopause. What about hormone therapy? Hormone therapy may be appropriate for some women who experience surgical menopause. It could help manage symptoms such as hot flashes and night sweats and can protect bone health. For some women who's had the uterus removed, estrogen therapy can generally be used without progesterone because there's no uterine lining that needs protection from estrogen. But hormone therapy isn't automatically appropriate for everyone. That decision depends on things like age, symptoms, medical history, cancer history, cardiovascular risk, and of course, other individual factors. So this is a discussion or a conversation to have with your healthcare provider. If your ovaries remain, you generally won't experience immediate menopause just because you had a hysterectomy. But research suggests that hysterectomy with ovarian preservation, meaning they don't take out the ovaries, may be associated with an earlier decline in ovarian function in some women. So even if their ovaries remain when the uterus is removed, the ovaries aren't working at 100% capacity for some. So they may start to experience perimenopause and menopausal symptoms earlier. What we cannot reliably do is give every woman a specific age and say, this is exactly when you'll go through menopause after your hysterectomy. There isn't a single average age that applies to everyone. So, do you still need a pap test? I had a patient today who never had a hysterectomy, but because she's in her 70s was told she no longer needed a pap test. And that doesn't sound right to me. So, whether you need a pap test depends on several things. Number one, did you have your cervix removed? Why did you have a hysterectomy? Have you ever had cervical cancer or high-grade cervical precancer? And how old are you? And what does your previous screening history look like? Under ACOG's updated 2026 cervical cancer screening guidance, routine cervical cancer screening is not recommended for people who have had a hysterectomy with the removal of the cervix and who don't have a history of cervical cancer or high-grade precancerous lesions. If your cervix remains after a supracervical or subtotal hysterectomy, you should continue cervical cancer screening according to the recommendations appropriate for your age and risk factors. And if you've had cervical cancer or significant cervical cell changes, you may still need ongoing surveillance. ACOG states that people with a history of cervical cancer or high-grade cervical changes should continue screening for 20 years after surgery. So please don't make the decision based solely on the word hysterectomy. Find out exactly what was removed and what your medical history means for your screening. Many of my patients often think that if they had a hysterectomy, they no longer need to see the gynecologist. They do. Not needing a pap test does not mean you no longer need gynecological or general health care, because these visits may still address menopausal symptoms, urinary problems, pelvic pain, sexual health, sexually transmitted infection testing or STI testing, vaccinations, age-appropriate cancer screening, and other preventative health care. Whether you need a pelvic exam depends on your symptoms, medical history, and the reason for the visit. This may sound like a silly question, but there are no silly questions. Can I still get pregnant? If your uterus has been removed, you cannot carry a pregnancy. That's one of the permanent effects of hysterectomy. So contraception is no longer necessary for pregnancy prevention. However, condoms may still be appropriate if you need protection against sexually transmitted infections. Okay. This is a biggie. What about the emotional side? This is a part of hysterectomy that deserves much more attention. Some women feel enormous relief after surgery. Maybe they've spent years dealing with heavy bleeding. Maybe they're exhausted from anemia. Maybe they've been living with chronic pelvic pain. Maybe they've been dealing with pressure from prolapse. And finally, the problem is being treated. But relief doesn't mean you can't also feel sadness. Hysterectomy permanently ends the ability to carry a pregnancy. For some women, that can bring up feelings of grief, even if they never planned to have another child. Others may struggle with changes in their body or how they think about their femininity or sexuality. And it's okay to have complicated feelings. You could be relieved that you had the surgery and still grieve what you've lost. These emotions can coexist, and believe me, they do. Now, let's talk about warning signs after surgery. When should you call your doctor after hysterectomy? You should contact your healthcare team if you experience the following: heavy vaginal bleeding, severe or worsening pain, fever or chills, foul-smelling vaginal discharge, redness, swelling, or drainage from the incision site, significant calf pain or swelling. And there are two symptoms I especially want to emphasize: shortness of breath and chest pain, because these can be signs of a potentially serious blood clot and will require urgent medical attention. If you're having those symptoms, don't wait around hoping they'll go away. The bottom line: hysterectomy is a major surgery, but for many women, it can also be life-changing in a very positive way. It can eliminate heavy menstrual bleeding. It can relieve symptoms caused by fibroids. It can address uterine prolapse. It can be part of a treatment for endometriosis or cancer. And for many people, it could dramatically improve quality of life. But the experience doesn't end when the surgery ends. Recovery takes time. Your body needs time to heal. Your hormones may or may not change dramatically, depending largely on what happens to your ovaries. Your sex life may change, or it may not. Your emotional response may be complicated, and your need for healthcare doesn't disappear. So ask questions. Get the details of your surgery. Know what was removed and what was left in place. And if something doesn't feel right during recovery, speak up, because understanding your body isn't TMI, too much information. It's healthcare. Before wrapping up today's episode, I'd like to make the following disclaimer. This episode is for general education and is not a substitute for individualized medical advice, recovery timelines, hormone therapy decisions, cervical cancer screening, and other recommendations can vary based on the type of surgery performed, medical history, age, and other individual factors. Listeners should follow the instructions of their healthcare team. Thanks for listening. Thank you for listening to Yeah, We're Going There with Dr. Natalie. If this conversation helped you feel more informed or less alone, consider subscribing, leaving a review, or sharing the episode. Until next time, yeah, we're going there because knowledge drives better health. This episode of Yeah, We're Going There is brought to you by Kindra. Kindra products offer full-spectrum relief from vaginal dryness, discomfort, sensitivity, itching, burning, and stinging. Their products, which include vaginal moisturizers, silicone lubricant, and pH-balanced shower and bath gel, are clinically tested and OB-GYN approved, hormone-free, paraben-free, phthalate-free, and FSA, HSA eligible. Recommended by over 7,500 medical providers and loved by over 330,000 women, including myself, I personally love the vulvovaginal hydration and relief duo and use them on the nights I don't apply my vaginal estrogen. To save 20% off your next order, go to www.ourkindra.com and enter code Dr. Natalie at checkout. I really think you'll love it as much as I do.